Welcome to the Vet Dental Show. I'm Brett Beckman, board certified veterinary dentist, and we bring this podcast to you every Wednesday as a veterinarian, as a technician, as a dentistry team to help you be even better at veterinary dentistry in your practice. We're sponsored and partnered today with the Veterinary Dental Practitioner Program. If you're interested in being among the best anywhere in general practice as a team in veterinary dentistry, I invite you to request an invitation. Let's go to ivdi.org/INV, like invitation, first three letters INV. So IVDI, International Veterinary Dentistry Institute, ivdi.org/INV, and we'll get you the information that you need. We are recommending sharpening elevators. We recommend that you do that, as I mentioned, once a week, if not every time that you use them would be great. And certainly most of us don't have time, or most practices don't have time to do that after every procedure. Once a week or at the end of the day certainly is another option for you. And there are videos in our technician online course that'll show you how to do that. And there are videos in some of the other courses as well, but that one specifically. And that technician online course is also consistent with the level 1 course that we do for veterinarians and technicians. So it's certainly great for veterinarians as well. So I think the question on this was, how do you get good exposure? And I may have overlaid that onto the question, but how do you get good exposure? You use a periosteal elevator, and that periosteal elevator is used to provide exposure to the entire length all the way to the apex of that tooth. So if you've got a canine like this that has no periodontal disease, you can go all the way to the apex if you need to remove bone and make this an easy extraction. You don't have to do that all the time. You don't have to do that in this case, but quick, efficient extraction involves removing as much bone as possible. And what's going to happen is that is going to have a blood clot in it when you close. All that's going to fill with bone again. That's going to be solid bone in 4 to 6 weeks. So removing more bone doesn't mean that you're compromising the patient. It means that this is going to fill with bone in 4 to 6 weeks, unless there's an oral-nasal fistula, and then that will fill with fibrous tissue and or some bone and will not be an issue either way. Kristen, are Greenies comparable to Oravet chews for dogs regarding plaque prevention? That's a good question. And from that standpoint, both of those are chewable. They're both safe based on the studies and based on clinical evidence. Greenies wasn't for a while. They reformulated years ago, and now they do digest. Not to say that they couldn't cause problems either way if they're swallowed whole. We don't recommend you just for the first several times give your pet one of these and not have them attended, and you watching them and how they manage those. If you have a dog that just takes a couple bites and swallows, that's not something you want to give them, because you're asking for potential problems, even though they say that they have been proven to be digestible. So that being said, Greenies, when you chew food or any treat, those Greenies included only get the caudal cheek teeth. And the same thing with Oravet, but Oravet has that wax component that is distributed with the saliva, with the tongue, with the cheek mucosa around the crown enamel, and covers that with wax. And wax is a lower surface energy than enamel itself. So the lower the surface energy, the less that something attracts other compounds or molecules. So less chance that plaque will adhere to a tooth that has wax on it. And so this gets all the teeth versus Greenies just helping with the caudal cheek tooth. That's why we recommend it for our home care. It's also AVDC or Veterinary Oral Health Council approved, vohc.org. And you can go to that and see all of the recommended home care that is recommended. We also recommend Healthy Mouth Water Additive because it gets everywhere. Research is done by the VOHC on multiple products. It's easy. The owners will do that, and they'll do Oravet. Brushing is ideal, but most owners aren't going to do it. Monique, any tips for closing a very large oral nasal fistula? Here is the equivalent of a very large oral nasal fistula that has been altered surgically to the point that we are ready to close it. And as you can see, there's a lot of tissue that's been exposed there. That fistula may have only been a half a centimeter, but it was high enough up on the dorsal aspect of the attached and maybe the unattached gingiva that created a hole that was big enough to remove, whether it be this size or, as you can see here, as big as this. And this, I think, was that perio case, but the oral nasal fistula is similar incision. So what we do is we carry this back, and we won't spend a lot of time on this because this is an advanced procedure. We carry this back. We're not trying to get tissue from up here and bring it down. We create a larger hole. We create a larger exposure. We can carry this back here if we need to. Sometimes we don't have to go that far back. And then all of this is undermined. And so if you lift this up, you see the neurovascular, or mainly the nerves coming back, and you can see them exposed here underneath this flap. And then all this is brought forward and closed. So that's how we do oral nasal fistulas. If they're anything other than super teeny tiny, or if they're associated with an extraction, that is where the palatal bone has been destroyed anyway, and we're just closing after extraction as a routine closure. Good question. Kim, what are your recommendations when there's bone loss at the furcation only and not significant bone loss around the root? This is a case of that, where this is a cat left mandible. You've got the third premolar there that's got tooth resorption on the distal and a little bit of tooth resorption at the crown on the mesial root. And then you've got that furcation exposure from periodontal disease on the fourth premolar. The determining factor on that is twofold. Number one, is the gingiva normal or close to normal? And can you get that gingiva so that it's exposed and brought down over the defect, which is an advanced procedure where we clean all this out and then we bring this tissue down and we suture it between the furcation so it exposes this so it can be cleaned, and we've got now a normal bone tissue interaction. That's not something you do in practice. So this is an extraction every time, unless, and I say unless, there is a situation where the attached gingiva has been following the recession and there's not a lot of inflammation there, if any. And that occurs sometimes in greyhounds and a lot of big dogs with large mouths. You'll get the recession that happens automatically without losing this attached gingiva. So it just follows the bone. And in some cases, that's okay. That's not a real common thing. Doesn't happen very often. But if that's the case, if you can clean and that patient comes back in 3 or 4 months for a recheck and there's no inflammation there, then you're probably okay with home care and cleaning every 10 to 12 months. But if you cannot alter that, and in cases where you have bone loss and it is such that you've got exposure like you have with that fourth premolar, where you've got a furcation that's about 25% or 20% of the length of the tooth root, and then you have bone underneath it, there's nothing you can do to alter that so that it won't come back without that apically positioned flap that I just described on a specialty level. So that is an extraction every time. You can't alter it. You can't clean that out and have that tissue remain and expect that not to be worse the next time you come. So that's an extraction. And that's in dogs or cats. I hope you enjoyed that episode. If you'd like more information about the Veterinary Dental Practitioners Program, please submit to request an invitation.